Vincent, and I'm the Vice President of Community and Corporate Impact for Greater Fort Wayne Inc. Greater Fort Wayne Inc., our job every day is to grow jobs, wages, and the economy for Allen County. Greater Fort Wayne Inc. works hard to bring investors the very best business opportunities. Today, you're going to hear about one of them. The Healthy Hoosier Discount Plan is an exclusive program just for Greater Fort Wayne Inc. investors through PHP. We will be recording this webinar and you will have access to the video on the Greater Fort Wayne Inc. YouTube channel, as well as it being mailed out or emailed out to each one of you tomorrow. Regarding questions, if you have questions during the webinar, please drop them in the Q&A icon located at the bottom of your screen. We will hold these questions until the end during our dedicated Q&A time. It is a privilege to be working so closely with the PHP organization and to be able to offer this amazing opportunity to our members. I would now like to introduce Matt Rakuski, Chief Sales Officer for PHP.
Thank you, Brenda. First of all, thank you to all the team at Greater Fort Wayne for helping us put this together. We really appreciate the opportunity to talk to everyone this morning. And there was a fair amount of logistical work behind the scenes. So thank you very much. And thank all of you for taking an hour out of your morning to spend with us and learn a little bit more about PHP. I'm sure everyone's super busy and we definitely appreciate your time. First of all, just a level set and make sure that everyone's familiar, at least on a certain level with PHP. I want to run through a little bit of our history and get everybody up to speed. So first of all, what does PHP do? Well, we provide and we administer employee health insurance. So all businesses, large and small, not-for-profits, government entities, churches, schools, you name it, pretty much everything but individuals. So we're working with employees throughout Northern Indiana of all shapes and sizes. We were started about 40 years ago by a group of local physicians who realized that the status quo wasn't quite good enough. They were looking for something better. And really that kind of created our DNA that is still present today in terms of just trying to be different, trying to look and provide something better to the community and the groups that we take care of. So here we are 40 years later, and we service over 1,200 employers throughout Northern Indiana. Again, large and small and all shapes and sizes of organizations. We're still in Fort Wayne, about 185 employees here in Fort Wayne. And as a non-for-profit organization, we kind of pride ourselves on the fact that our revenues go back to the community. We fund the PHP Foundation, and that foundation on an annual basis provides donations to charitable organizations throughout Northern Indiana. And in terms of governance, we do not have shareholders. We're not encumbered by Wall Street investors. We are governed by a board of directors, which is comprised of local physicians and business leaders around Northern Indiana. So I'm sure you're familiar with a variety of insurance carriers, be it employee health insurance or otherwise. And in fact, there's a lot of similarities between PHP and the big guys, but there are also some things that make us different, some things that we sort of hang our hat on. And the first one is the fact that we're local. Like I mentioned, we're started in Fort Wayne, we're still in Fort Wayne, and quite frankly, we feel like we are you. We are an organization in Northern Indiana who is trying to do the right thing, trying to take care of our customers, take care of our employees, take care of our community. So right out of the gate, we're very similar with our clientele, which does make a difference. And what our clients and our broker partners will tell us that they like the most about the fact that we're local is we're accessible and we're responsive. Our door is always open. We meet quite frequently actually with our client groups here in our office or actually on site as well. And it's not just the sales team, everyone up to our CEO, our chief operating officer, our pharmacists will go out and meet with our clients and spend time to get to know them and their unique challenges and really build a partnership that way. So part of being local, I guess, means that there's nowhere to hide. But we take pride in that, and we want to make sure that we're as accessible and responsible as we can be. And that brings about a sense of accountability, because like I said, we are we are in the community. We're going to the same churches and the same schools and the same shopping centers and grocery stores as all the people we work with. So there's a degree of accountability there. We feel a sense of having to take care of the folks that are in our community. So being local definitely sets us apart from the rest, and hopefully what you hear today and the experience that you would have with PHP proves that to be true, that we are a little bit different than the rest, and that DNA that was created 40 years ago is still ringing true with PHP today. So with that, I'll turn it over to Ross Hensley. Ross is our regional director here for the Northeast Territory of Indiana, and he will walk you through our program today. So take it away, Ross.
Yeah, thank you, Matt. As Matt had mentioned, my name is Ross Hensley, and I'm the regional director here at PHP, and very excited to spend some time with you and be on the call with you guys today. So thank you to Greater Fort Wayne Inc. for allowing us to take some of your time, and thank you for all of you. We feel like we have some very, very exciting things to share with you today, and we won't spend a ton of time on it, but we're always available, as Matt had mentioned. So feel free. We do have questions and answers at the end, but if you ever want to reach out to us, feel free to give us a call and we can just chat as well. Let's see here. So I'm going to go through a couple different things with you today. So first, what I'll start with is the current insurance landscape. So where are we today and how did we get here? In addition to that, I will discuss some new product opportunities that we do have here at PHP that might be a great fit for you and your team as well. Then really with the bulk of this and the idea of this whole meeting is to discuss the chamber discount program opportunity that we have out there. I'm sure with that, you're going to have some questions around our network. So what kind of doctors, hospitals, facilities, and things can you go to in this program? So we'll be sure to cover that as well. And then just some additional PHP services that we have for our employer groups. And then at that point, I'll turn it over to Erica, who is our new account executive here at PHP, for some closing remarks. So looking at the current insurance landscape, a couple of things. So how did we get here? How are prices developed in the market? Where do these models come from? And then where do we go from here? So I'll cover a couple of these things today. So I'm sure that as many of you know, I'm sure everyone has heard of the Affordable Care Act that came out in 2010. And it really changed the landscape for the health insurance market. It did a lot of different things, you know, eliminated pre-existing conditions and things like that. But really for today's purpose and what I want to discuss, and I think what you want to hear is, how did it affect the small group employers? So those employer groups of 2 to 50 employees, what happened? How did it change the pricing from an insurance carrier's perspective? And how can we look at these groups differently in the future moving forward? So what I really want to focus on is those rating factors, which is at the bottom of this slide here. So a rating factor is simply, what can a health insurance carrier look at in order to price a group? So in that ACA market, that Affordable Care Act market, in that 2 to 50 space, there's really only a couple different things that a health insurance can look at to develop the price. So one of those is going to be the age. So what's the birth date of all the people that are enrolling on the plan? What's the region? So where do they live? What home zip code do they have? Plan design / what category? So am I in a high deductible health plan or a traditional health plan? The pricing can change there. And then the fourth is tobacco, but we don't use that at PHP as a rating factor. So really, we're just looking at those three things. So let me give you a couple of examples of a real world situation where you can see where this could be advantageous and could not be advantageous. So I'll give you an example here of two individuals. One is named Mike and one is named Joe. So Mike was born on January 1st, 1980. So he is 41 years old and he lives in 46804 here in Fort Wayne. And Mike is as healthy as can be, takes great care of himself, eats right, has a great diet, exercise, and all those things. And as a specimen of health, can't get any more healthy. Very small utilizer of the health plan because he takes care of himself. On the other hand, we have Joe. So Joe was born the same day as Mike, ironically enough, and lives in the same zip code. Now, however, Joe has chosen a much different lifestyle. So Joe is very unhealthy, doesn't take care of himself, very poor diet, does not exercise. Very, very bad situation going on for Joe. Now, under this ACA market and this pricing, and to tie this all together, those two individuals, given those same rating factors, are going to pay exactly the same price and premium to the health insurance carrier, no matter what their utilization is. So Mike, who is not using the health plan because he's taking care of himself, is subsidizing, paying a lot of his premium to help out Joe, who's using over a lot of the premium up. So those two are two contrasts of how that's priced and why there might be a different solution out there for other folks. So this is where I'll introduce a different concept called level funded health plans. So if we take that example of those two individuals and we look at that from a group perspective. So if I'm a healthy employer group and I'm on the ACA market and we aren't using our plan and we're not costing a ton of money out there in the health insurance market, why are we subsidizing those folks that are, or those groups that are? So again, introduce what we call level funded health plans. So this is different than the ACA because it has some different funding mechanisms. So how you pay the claims and how those operate are different. So with that, it's actually governed by a different federal law, which is called ERISA. So ERISA is Employee Retirement Income Securities Act. So why is that important? It's important because that gets around the ACA and some of those mandates so that we can look at pricing this differently. So maybe we can save some premium dollars for those groups that are healthy. So we, again, don't have to subsidize those groups that are unhealthy. PHP has a unique program called for this level funded idea called Level Solutions. So the level funded concept has been around for a long time, but it's gotten much more popular here over the last few years with the ACA mandates. Again, those folks that are healthy don't want to subsidize the other ones. So that's really the big concept behind the level funded or level solutions health plans. So what is level solutions? So a couple different things within there. It's for group sizes 5 to 100 enrolled employees in this chamber program, which I'll get into here a little bit later, is 5 to 50. And it's medically underwritten. So this is the biggest piece to this whole pie here. Medically underwritten means that we're going to look at your particular group and what those demographics are and see if you should be paying less than what the average population is because you're more healthy. And that could end up giving you some potential premium savings. There's some other advantages here as well. So there's plan design flexibility. So there's more opportunity to change what kind of plans you guys do want as opposed to what's on the ACA market. There's also extensive RX, so prescription coverage. So it includes injectables, specialty drugs. We'll get into some of the reporting a little bit later. And there's also an opportunity on the refund. So if you do two refunds, so if you do run better than expected, there's a good opportunity there. Now, the nice thing for an employer group, so me on the call here, if I own a company or I'm a plan administrator, this is going to look and feel very similar to a fully insured product. So like the ACA that we had described earlier, it's going to look and feel that way. But then internally, PHP will do a lot of the heavy lifting to make this work for you to help save some dollars. So how does Level Solutions work? So this is a plan that's going to be tailored around you. PHP is going to help you with this. We can help you as well as your benefits advisor can help tailor these programs around you and what you're looking for. You're going to pay the costs incurred by your employees, but there's also insurance built into this to help you from some catastrophic illnesses and claims. I'll get into that here in a second. But again, the big piece is here that we will help do a lot of the heavy lifting, and it's going to look and feel to you just like like a fully insured program. So what is Level Solutions? To kind of get into the weeds a little bit more here. So really, let's think about this as just $1 coming in to PHP on the Level Solutions product. So where's that dollar going to go? Where's that money going to be spent? There's really 3 different avenues or 3 different buckets that these dollars would go to. So we have a claims funding bucket, a stop loss coverage bucket, and an administrative expense bucket. So looking at the claims funding bucket, this is going to be where that underwriting comes into place that I had mentioned earlier. And what simply that is, what are the expected healthcare costs of this group? So if we go back to my example of Mike and Joe, I had mentioned earlier, Mike's expected expenses would be much lower than Joe's. So the claims funding would be much less, therefore as premium or as dollars coming in would be much less because it's a healthier population. The second piece to this is stop loss coverage. So this is going to be the insurance built in to protect you and your plan from those large claims that that can happen time to time, right? So that's why you buy insurance. So for example, if I got hit by a bus tomorrow, heaven forbid, I won't necessarily derail the entire plan because there are these protections built in place. Also, if not only me, but there's a lot of different things that happen throughout the year, much more than expected claims activity, there's insurance built on the back end as well. So the nice thing is I'm going to have some flexibility with the claims funding. I'm also going to have protections built in place in case if the wheels fall off. And then the last bucket is the administrative piece. So that's where PHP is going to adjudicate claims, negotiate on your behalf with providers and that kind of administrative piece. Also, the actual claims experience may vary, yet the payments remain the same. So this is a big piece to this of what we had discussed earlier to the employer. This is going to look and feel like a fully insured product. So my 12 months of claims are going to remain the same, assuming that my membership remains the same, just to keep this easy. I don't have to fund the claims if it goes up and down like you naturally would under a self-funded plan. I'm just going to pay the level premium throughout the year, and then set up on the back end. So there is a potential for a refund. So let's look at this under two different scenarios. So what's the best case scenario? So if I'm an employer group and I'm healthy and I want to do this, what's the best case scenario? So the best case scenario would be that we don't spend all of what's in that expected healthcare cost. So we're paying our monthly premium and we don't end up spending as much in claims as what we had anticipated. So what happens? Does PHP get to keep that money? That's our money. No, we don't. So we actually have the opportunity to give a portion of that back to the employer group because those are your dollars. So that's what makes this unique. On an ACA plan, doesn't matter what your claims are or what they aren't. At the end of the day, after 12 months, all that money went to the health insurance carrier and you're not going to see any of those dollars back. So this gives you an opportunity that if you take care of yourself, take care of the health plan, you have the opportunity to get some of that back. Now let's look at the other side of this. So what's the worst case scenario? Let's say that I hit way higher than my expected claims cost and I don't know what to do because I don't have any dollars left in that claims fund. Well, the good news is you're not going to owe PHP back any of that money. It's just what would happen is at your renewal. So looking at the next contract year, you might have a renewal increase, but you're never going to owe us back any dollars that you had spent more than what that expected was. So much like an ACA plan, at the end of the year, you just wash your hands. I paid my 12 months. I ended up spending more than what we expected, but you're not going to have to write a check back for the additional expense there. So kind of the best of both worlds in terms of that. What I would say is this can be more complicated as you can imagine, but this is a great stopping point here to take a step back and say, hey, this sounds very interesting. I'm going to keep this very high level today, but I would encourage you, if you have questions or you want to learn more about this and the details within it, contact us or contact your benefits advisor, broker, consultant, whatever the case is there. Be able to sit down with you and go more in depth. Again, this is just a high level overview of the Level Solutions product. So now let me transition over to the Healthy Hoosier Chamber Discount Program. So this is what the idea of this call was today, right? So with our great partnership with the Greater Fort Wayne Inc., we have developed this program that we will allow members of the chamber to receive a 5% additional discount on that Level Solutions product that I had just walked through. So you can see here at the bottom, there's some real life examples of current groups that have gone through this program here just recently and what their potential savings are. So very excited about this. Appreciate Greater Fort Wayne Inc. partnering with us. And this is a great program for many people here in Fort Wayne. So we're excited. So to get a little bit more into the details about the program, this program is for employers with 5 to 50 enrolled employees. It could be a current PHP account, so renewing, or it could be new to PHP, have to be a member of the chamber, by the effective date. And this discount is applicable only to that Level Solutions product that I had just described. Okay. So again, really excited about this. I appreciate the Greater Fort Wayne stepping up and working with us on this to help the membership save an additional 5%. So a couple other things here real quickly. So I know one of the questions that many people have is, well, what kind of networks? So what doctors and facilities do I have the ability to go see? Have a couple different options. So we have both broad, so bigger networks, and more narrow networks here in Fort Wayne. So we can include Parkview, Lutheran, IU. And also we have the ability to cover employees outside of the state of Indiana. So we are partnered with PHCS Multiplan Network, which is one of the largest rental networks in the country. So a lot of doctors, a lot of facilities and things like that under that. Happy to go more in depth with the offline regarding that. But at the end of the day, the good news is that we have the solution for not only Fort Wayne, but also those remote employees as well. So another big piece to this is not only do we want to take care of our current employees, but moving forward, like how do we keep everyone healthy for a long-term goal, right? So there's a couple different services that PHP does offer that are built into our plan. So we do have some online wellness programs and coaching, and then we also have telehealth. So as you can imagine, telehealth has really grown over the last couple of years. With COVID and some other things. I'll give you a real world example. A coworker of mine, so let me back up. What telehealth is, it gives you the opportunity to call or FaceTime a US board certified physician, and they can actually prescribe medication over the phone. So this is going to be for your, I've got the sniffles, I don't need to go to the ER, that kind of stuff. What can I do, right? Ear infections and that kind of thing. So I'll give you a real world example. I had a coworker of mine who had done some hiking, and she believed that she had poison ivy. So rather than taking time off of work, scheduling an appointment, or going into the urgent care, just called telehealth. So Parkview on Demand, and they said, FaceTimed with her. Yep, that's poison ivy. And they were able to prescribe medication over the phone. She just picked up from her pharmacy after work. So all in all, it's about 10 or 15 minutes in, as opposed to taking half a day off of work to go in. A couple other things that we do have is a diabetes specialty program education. So diabetes is a very serious condition, and we have different programs built there to help you every step along the way. So lastly, what I'll go through is this employee self-service. So as you can imagine, technology has changed a lot of things, especially over the last few years. So we do have the ability for some technological pieces here at PHP. So there is the mobile app. So you're able to get your ID cards online on your phone, treatment cost estimate. There's a lot of tools and resources online that they also are all built into these programs. So with that, I'm going to turn this over to Erica Hines. So Erica is a new account executive with PHP. Erica, go ahead, take it away.
Hey everyone, I just wanted to jump on real quick and thank you all for attending our webinar today to discuss the PHP partnership with Greater Fort Wayne Inc. and offer some of those additional discounts on our Level Solutions product. I do want to touch base real quick. There will be an anonymous survey that is going to be emailed to you probably tomorrow from Greater Fort Wayne Inc. If you would just, do that survey, we would greatly appreciate it because it'll give us feedback on how our presentation was today. We're also going to transition into an open Q&A. We do see that we have a couple of questions that have popped up on our chat, so we will get to those. If we do not get to a question that you have or we didn't answer anything, please feel free to reach out to your broker. You can contact a PHP representative as well. We're always around to help answer any questions that you have. So yeah, I just wanted to say hi. Thank you everybody for attending. We will open up the chat and I'll give you back to Russ. So thanks everyone.
All right, thank you, Eric. I appreciate it. So I'm just trying to get these questions pulled up here. Let's see here. A couple of these we've actually answered through the presentation here. I'm just glancing. One question we did have that we had discussed was, what do you do for those employees that are outside the state of Indiana? So again, we had discussed this earlier, but they would be on a PHCS multi-plan network. So again, we do have that coverage for those employers that have remote employees. Let's see here. I'll glance through this. Yeah, sorry, give me one moment here. So does this apply to local chambers as well? So this program is built for chambers that we partner with specifically. So this does not apply to any chamber that is out there. This exclusively here is for the chambers that we do partner with. Let's see here. Does the Level Solutions plan allow for contributions to HSA accounts? Yes, that is built in. So we do have HSA compatibility. High deductible health plans are part of the plan offerings out there. Yeah. Let's see. I'll tell you what, that covers pretty much most of the questions. A couple of these are a little more into the weeds. So we do have your contact information, and what we will do is those add some questions a little bit more into the weeds rather than go through into over this call. What we'll do is we'll be sure to contact you individually and answer these to the fullest extent. So again, that's all we have for you guys today. Really do appreciate your time and appreciate Greater Fort Wayne as well for all that they do to help us. So thank you all. Have a great day and feel free to reach out with any questions.